Hello, my name is Miss Stella Imafidon. I'm a nurse. All right, what really inspired me to become a nurse? Because I love to save life and I love to give treatment to people. So drugs like augmentin, which is an antibiotic that will fight against germs, fight against low immune system, like all those bacteria or patients that go through surgery. Because it's very important that you use those drugs for the patient for quick recovery and for quick healing. Like that augmentin is very hard to get, but we have many unbranded one outside, but they are not really effective like the branded one, which is called your augmentin. But for you to get it, you can go to the big pharmacies to get it, and it's very scarce and very expensive. And the other one, like Zenat, also is also a very strong antibiotic that you use for patients that are suffering from a severe infection, like all those sickle cells. They are being used for them also to fight against germs that affect them, that bring down their immune system, that make them to easily fall heal. So those drugs are very important and they are very scarce. And we have also other drugs like multivitamin, like this histamine. It was very common before, but as we speak now, it's very scarce to get and it's very expensive also. This also help you to build your immune system to fight against bacteria, like all these malaria, anemic, because it contains a vital multivitamin like amino acid and the rest of them. So it's very good for appetizer. Maybe when you have a patient that doesn't have appetite to really eat, when that drug is being used for the patient, it's very quick to recover and it's very vital in the body of a patient. You know, in Africa, especially in our country here in Nigeria, we are always used to self-medication. You will hear that someone said, my neighbor used this drug, whereas the illness that the person is suffering from and which that other person is suffering from is very different. But they try to compare it together and give themselves a self-medication, which is very wrong, because you have to really know the rules of that illness that that person is suffering from. Don't compare it with Mr. A to Mr. B. And body varies. Our immune system varies, our blood group varies, our genotype varies, because we are not the same. So in that aspect, as a nurse, how can you come in to help those patients in that kind of situation? You send the person for a test. You send the person to a laboratory to really confirm and know the actual thing that is wrong with that patient. So with that, you can tackle the main issue that is wrong with that. How can nurses like me help patients in that kind of situation? Is to give sensitization, to really educate the patient about those things that are very common, the little mistake that people make. You sensitize them, you lecture them, let them know the effects of what they are doing and the benefit of what they are doing also, what they will get if they can avoid those things. The food you eat matters a lot. Balanced diet, it matters. Water is life, and your environment also matters. You make sure that your environment is very clean, because when your environment is clean, those things will be far from you. But when you live in a dirty environment, you can easily be contacted or contact those germs that will make you to be healed. You understand? So secondly, you need to take enough water to flush your kidney, your body system to function well. For your bladder to be very healthy and for your kidney to be healthy, you need a lot of water. It's very important. And secondly, you need fruit. In Africa, most of us, we don't take fruit. We just wake up in the morning, just eat carbohydrate because we love carbohydrate a lot. We don't even deal with fruit at all. But fruit is very important in our body because it's good for our skin. It makes your skin to be healthy, your heart, and your body. So it's very good that we take fruit. And secondly, we should try to balance our diet. Not eating one particular diet. At least you take carbohydrate, you take protein, you take fat. So when you combine all this together, you will live a healthy life. Like for some people that doesn't regard the nurses, without the nurses, there is no way the doctor can work. Because the way the nurses depends on the doctor, that is how the doctors also depends on the nurses. If you can see, as for instance now, in the hospital, nurses are the one that give medication. Doctor is there to prescribe, while the nurses are there to administer the drugs, the treatment to the patient. So the way doctors are important, also the nurses are very important in the clinic. But there are some people that look down on nurses. Maybe when you see you're saying, I beg you, that nurse. It's wrong. The way you give respect to the doctors, I also urge that the same respect be given to the nurses because they are there to save life also. Like for some people that doesn't complete their medication, I will say that is drug abuse, because normally you are supposed to complete the dose because the doctor or the nurse that wrote the drugs for you, he know how long that the drugs is going to take to work in your body system. Do you understand? So you not completing the dose, you are giving chance for more illness to come, because it may subside at that moment. You understand? It may subside, but before you know it, you just see some people, they say, hey, I treated, like, let's use malaria as an instance, as an example now. They'll say, I treated malaria last week, and this month again, I'm treating malaria. Okay, you will not ask, okay, the drugs you took that last week, did you complete it? He said, I took 2 doses out of it. So I was okay, I'm used to that. But that is wrong. When you are asked to take a certain medication, you should try and complete it, because a time will come that those drugs will not be effective in your body again because you have abused the use of that drug. All right, wait. I believe that you enjoyed this broadcast, and I urge you to follow us, follow us, listen, and subscribe to our channel, and I believe you will not regret it.